Joining us now via Skype from the UK is Senior Research Associate, Cardiff University, Dr. Ruth Iku. Dr. Iku, good morning. It's good to have you join us this morning. Now, I know you've been following this development of spike in the number and figures of coronavirus across the world. Talk to us basically from the UK where you are. How are people reacting to this frenzy?
Well, here in the UK, everyone is holding up. The NHS is quite proactive about it. Just yesterday, we had a very huge show of demonstration of support for the NHS. The NHS and Boris Johnson has announced support across the country, support in terms of opening relief centers and ensuring that there are support staff to help people with mild symptoms and to also help to relieve symptoms of those with critical conditions. Unfortunately, as usual, we've lost people to this disease, but in general, everyone is, staying home, staying safe, and just doing what they can to contain the spread, basically.
All right, two critical measures that is being adopted by most countries affected by the pandemic is self-isolation and social distancing. Talk to us how effective it has been in the UK and from what you have seen across the world.
I think the purpose of self-isolation and social distancing is to contain the spread of coronavirus itself. And that has been quite effective in the UK because everyone, as at 3 weeks ago, the UK's response to the problem wasn't as critical as it was today, because I don't think people had actually grasped this seriousness of the problem. But with the increased rate in deaths, which was an exponential increase, people began to understand how serious the problem was, and I think they were more inclined to abide by the social distancing and self-isolation rule. So self-isolation in terms of if you recognize the mild symptoms of coronavirus in yourself, you are advised to stay home, which people have actually done, and tell people around you that you have recognized the symptoms. And people are basically staying indoors and only going out for essential critical things like shopping.
Oh yeah, all right. Talking about shopping, Dr. Ikudi, I wonder, there is, around here, there's a talk about panic buying. We've also read reports of panic buying from the United States and other countries. How is it in the UK? How are people panic buying things to stock up against the unforeseen?
Well, I can tell you this, that the shelves are empty, especially in terms of pasta, bread, all non-perishable foods are gone. People are into powdered milk now. So yes, people are buying. There have been talks of fights over the last issues in stores and everything, but the stores are not, they've not been asked to close down. So they will be open. The issue is if they will have stock that you need. So you actually can still walk down to the store, but the shelves are cleared. There is very little there that you can actually buy.
Earlier you talked about the fact that some persons were not taking this pandemic seriously until there was a spike in cases and perhaps records of deaths. Talk to us now what the level of awareness is and consciousness with regards to the pandemic.
Well, I think the major problem here is the lack of treatment for the disease in itself. So the best that we can do is to contain the spread and isolate cases of where we've observed that this disease is present. So the best solution for that is to basically stay away from other people, because one is you may not know you have that disease until about 14 days later, in which time or which period you must have made immediate contact with others. And it's said that just one person can spread the disease 400 to 400 new people in a month. if you do not self-isolate. But if you do stay away from others and observe social distancing law, that number is reduced to about just 15 cases, which is actually a good number. So I think the social distancing is the best option we have for now, and people should think about obeying it.
All right. Dr. Ruth Iku, Senior Research Associate at Cardiff University, thank you for talking to us on TVC Breakfast. Joining us via Skype from the UK is Senior Research Associate, Cardiff University, Dr. Ruth Iku. Dr. Iku, good morning. It's good to have you join us right now. From people's reaction and comments from people, they say that the world would not remain the same again after coronavirus. What are you seeing? What scenarios do you see playing forward after all this?
I think there are a lot of things that would be affected by the outcome of coronavirus. First, I think the most important one that immediately jumps out to you is the way we work. So this situation has really got employers and owners of industry to begin to rethink how we work and what are actually the necessary resources. I mean, you have CEOs actually say, you know what, we actually don't need all these people. So that's one thing that immediately jumps out to you. Something else that may be affected is travel. We are not sure if there will be tighter borders or if life will return back to as we knew it. But definitely there will be a lot of testing and more control over international travel. I think those are the two main things that actually jump out when you think about the outcomes of coronavirus in the end.
All right, I'd like to quote the statement made by the UK Prime Minister saying that he said, we can turn the tide in the next 12 weeks. How confident are you with the response you are seeing the government making or efforts the government is making? 12 weeks. Did you see the tide turning?
Well, yes. With the rate at which everyone has sort of stood up to the challenge and everyone is kind of doing what they are told to do and basically everyone is cooperating and all hands are on deck. The problem we have is testing. So we don't actually, the figures you see and the figures you quote are just numbers of known cases. And I think one of the issues with coronavirus is that you don't actually know that you actually have the disease until some time later. So we would only know those who have actually contacted the disease today, 2 weeks from now, potentially. So in that sense, we expect the number of corona cases to keep increasing until we are able to find a way to substantially reduce it. So yes, I think Boris Johnson is on the right track by saying in 12 weeks we will be able to, but I really doubt that in 12 weeks we'll be able to have contained all coronavirus cases in the UK. That's a bit optimistic.
All right. How are people reacting to the frenzy, the panic, and the fear that's in the air about the coronavirus? What are you seeing?
Well, to be honest, the reaction in the UK is basically keep calm, life will go on, and don't panic. And everybody's just waiting patiently until the situation can be contained. Is there a panic of people? Well, people are afraid. People are afraid for their jobs. People are afraid for what impact this will have on them. You talk about immigrants and immigration. There are people whose jobs are affected by this. So I think you talked about the government committing to paying people whether they are working or not. But that's just in the skilled labor market. They have people who work in coffee shops that are not sure of the future of their jobs. So people are afraid of these sort of things. So I think for the UK, we are just keeping calm, basically, and just waiting to see how the world would change, how much things will change after coronavirus incidents.
All right, talk to us about capacity, that is medical personnel at this point. How is the NHS coping?
Oh wow, that has been really phenomenal because in addition to NHS staffs themselves, there has been at least 409 volunteers, 400, approximately 400,000 volunteers that have agreed to join the NHS efforts. There has been a lot of relief centers, COVID centers set up across the country, field centers, where these centers are dedicated to um, tackling people who have observed mild symptoms. And basically, these centers are just there to provide relief to these symptoms. Remember, there is no known cure for this yet. So the NHS is responding very well to this. And we have a very good response, not just from the NHS, but from the citizens of the UK ourselves.
All right, Senior Research Associate, Cardiff University, Dr. Ruth Iku, thank you so much for talking to us on TVC Breakfast.